thing, which we didn't really hear much about yesterday, and I'm pretty sure they just kind of needed a day to just assess where they're at. So we're going to be asking those questions. One of the questions that a lot of people have been asking is about the Lieutenant Governor Josh Tenorio. And, we were concerned. We had said yesterday, at this point, we just want to know if he's okay. And right. I want to thank him for, reaching out and calling us. Good morning, Lieutenant Governor. Oh. Uh-oh.
Okay. Can you call back?
Yeah, just call back. I don't know what happened. And don't blame me, Bree. Everything was set there. It was on hold. It was all looking good and everything. Mm-hmm. Okay, so we'll just do that. We want to go over the numbers real quick. The latest from the Joint Information Center, COVID-19.
All right, the latest from the Joint Information Center. They're out. You got me there?
Yeah.
The release came out at 10 o'clock last night. Public Health tested 34 individuals for COVID on Thursday. 3 tested positive and 31 tested negative. Public Health's overall count includes additional 2 cases of COVID-19 that have been clinically diagnosed. While these cases have tested negative, they have image findings consistent with COVID-19 and display typical symptoms, have epidemiological links to previously confirmed cases, and are being treated as COVID-19 cases. The overall count also includes 11 positive cases that were tested by the Naval Health Research Center in San Diego and 1 confirmed positive case through DLS. A total of 126 cases tested positive and 2 were clinically diagnosed, with 33 recoveries and 4 deaths. So the total confirmed cases of COVID-19 on Guam is at 128. As for the CNMI, we are still waiting for the latest results from the CNMI, but at last count, it was 11 confirmed cases in the CNMI.
All right, so let's try this again. Lieutenant Governor Josh Tenorio, welcome to the show, LT.
Hey, good morning. This is my first time.
Good morning. Well, we'll go
first
easy
of
on
many,
you.
we hope.
Yeah,
Yeah, no, this is your new format. I think it's pretty cool.
Yeah, so
And you know what? First of all, just thank you for continuing to come to work and for the news team trying to get the word out. I really do think that if we continue on this track and do a little bit more, we'll be able to really beat this thing down.
Yeah,
Agreed.
that's our goal here. We don't want to just flatten the curve. We want to kill the curve.
That's right. That's right. And it will be a good place for us to do it in the world, since we pretty much have a closed border at this time with the quarantine measures we've taken. And because we have a relatively, small population compared to other places, I think that I'm very optimistic that we'll be able to find a way.
So what are the things that you've been working on?
So, I'll give you maybe an insight on what's going on a daily basis for me and for our team. Every day at 8:30, the governor and I meet with our team, the chief medical advisor. We have our people with our finance and people focused on the economy, and then our legal team, just trying to recap about everything that's happened the day before. The governor usually gets on these early morning calls with the vice president and the president. She's been able, both of us have been able to talk to senior military leadership, tracking the kind of assistance that can be brought in, and really just trying to manage this very actively and making decisions to try and protect more people. And so then at 10 o'clock, we go into a partial Zoom meeting, partial in-person meeting with very limited leadership in the public safety and public health front, the airport. We monitor everything that's been, all the people coming in, any issues that are outstanding, what resources departments need, and trying to plan for, the next few days. And that's kind of like, that occupies most of the earlier part of the day. I decided to stop coming to, we're trying to adopt social distancing and and really trying to manage what our risk is. And so in the afternoons, we'll split, we'll work from home, we'll be on the phone, and then the next day we'll do it. So we've been at this every day, and we will do this through the end of this crisis.
LT, so is that why people haven't been seeing you consistently at the press conferences? Because, and I was wondering about that. That was one of the questions I wanted to ask. Was what measures has the governor and the lieutenant governor and you guys' teams taken to kind of mitigate the risk that, it's a real risk, man. You guys are rubbing elbows with,
limiting the, trying to push as many things into Zoom as possible. knowing that there are some people that we need to see, but using the 6-foot rule, everybody at this point wears masks, and we really try and reduce the risk that we have, because quite frankly, we're meeting with a lot of people that are first responders, even people in the medical team that the leaders of the hospital that are in areas where there is a high risk. And part of it is trying to get all the employees and all the visitors to practice the protective measures for yourself. So, making sure that, and that's why there's, in the last few weeks too, trying to really examine and understand what more we can do to help the medical professionals make sure they always have the equipment that they need, but also to make sure to remind everybody to rely on their training and practice all their infectious disease control training. So part of it is identifying resources. I was able to, I probably speak often to superintendent who, all the school nurses, as you know, have been called up to public health service, and they're out there. We keep an eye on the staffing levels right now on a daily basis. We keep an eye on the number of people in the hospital, what their conditions are, and then also the number of resources we're putting into surveillance. So if there's already more than 120 cases, each one of those cases, the individuals have to be identified, obviously. They have to be interviewed, and then they have to be traced. And so we were able to send in additional people. There's AGs investigators, probation officers, social workers, retired nurses working phones to mitigate their risk, to try and really do an adequate mapping about what's happening and where clusters would be or could be. And I think the other thing that has been valuable about how we are operating is, and I have to say that it's been very critical for the National Guard to have been there. Dr. Mike Cruz as the Chief Medical Advisor, and Major Louis Cruz, another doctor, Dr. Cabrera, understanding where we are, including what's coming into the island for medical supplies. And then the other thing I probably want to say is that being aggressive, trying to identify all routes that we can get available to try and expand the testing capacity that we have. So, we're limited with the CDC testing to just a little bit above 40 a day, and the governor has been successful in trying to identify and get transshipped additional methods of testing. Because that's part of it, if you're reading what's going on, is you need to try and get as many people tested. And quite frankly, when we plan to reopen the economy, having a mass community testing is probably what is needed for us to get back on track.
What are we going to do, LT, when we do that? And this is something that the doctors have said, when we do that mass community testing and then we're sitting here with like 500 positives, is that going to, how do we deal with that?
I think what we might find, and this is just based on reading the articles and even watching some of the national news, there are probably a lot of people that were asymptomatic that never had symptoms that have those antibodies. And I think in the near future, when we do massive testing, I think we're going to find that many more people have been exposed, just like what they're finding in the States and in Europe and in China.
Yeah.
Mm-hmm. Can you tell us about Dr. Felix Cabrera? He's briefing the military, I believe, today. We just
this morning.
This morning.
Yeah.
Do you know any information about that?
So on a daily basis, the U.S. Army Corps of Engineers, FEMA, Center for Disease Control, there are all different models that are going around, and Dr. Cabrera has done an excellent job trying to apply those models and being very forward-thinking on the models in terms of projecting what the need is. And part of it is really planning logistics and identifying the number of healthcare assets we need to bring in and to step up. So, we know how many additional beds that we're able to step up in the hospital setting. We know we've been looking at all sorts of scenarios to even doing some mobile hospital units coordinating with the private healthcare providers, the clinics, the surgery center is another one, and trying to have a very unified approach to how we address healthcare. And so it's this probably not the first time he has a briefing today, but I would just tell you that there's been daily communication and pretty good open communication with the military partnership.
Right. I think what we were kind of wondering about is with these developments with Theodore Roosevelt, where they're now looking at 187 sailors who are symptomatic, and over 400 have tested positive. Is the military capable, and do they have the capacity to handle that many positives, that many symptomatic sailors and more? Are we looking at maybe is there going to be a sharing of resources outside the fence line? Where are we on that? And can you tell us?
No, they have the capacity, and over the last few days, they have expanded their capacity. They have been flying in medical professionals in the military to come in and handle this. And what I'm very happy about is those resources are going to stay in put after they clear and get the Theodore Roosevelt underway. Those medical assets remain and will remain to support the island of Guam, and actually would already be in a posture to actively support the government of Guam.
Right.
Speaking of flying in of medical teams, do you have any information about this strike team that is supposedly going to be arriving to Guam?
Well, I'm sure I'll get the update on at 10, but we have already known for days, and actually it's in response to the requests that we've been making over the last several weeks. Part of these requests are coordinated by our surgical unit or their medical unit of the Guard under Dr. Cruz, in close collaboration and with the lines opened by the FEMA team and our Civil Defense Office.
So what are some of
we've been we had already been tracking additional testing capacity, PPEs. And then making a hard ask for additional medical staff. And in fact, there are additional, even private medical resources coming on available as state of Washington and state of California have seemed to averted a big crisis.
What are some of the asks?
Medical personnel. In fact, I would just maybe tell you the governor's press conference at 1, she'll probably be making an announcement of additional equipment and supplies coming in from some other sources that have come online, partly with the support and facilitation of the military. But we've asked for beds for. Obviously the military responded and sent us about 34 ventilators with PPEs and even medicine. We also have a very good coordinated effort. We understand what's going on with the local pharmacy community. What are the drugs that are needed? Even thinking big over the next few months, making sure that people that have difficulties with access to healthcare or are filling their meds for all their maintenance drugs. Because on top of it, don't forget that we have a very unhealthy community. A lot of diabetes, a lot of heart disease, and those people need to continue on getting their meds. So that's part of it. The other side is coordinating all of the relief and the response efforts to people that are hurting right now because they are no longer living paycheck to paycheck. There's no check. And so the announcement the governor made about trying to get, being able to push out for about 10,000 people that are earning the lowest in the first wave to get some immediate help is making a difference. I also have to say that DOE's feeding program has been an excellent gap. Filling the gap, and then in the next few days, one of the most difficult, complicated issues has always been the homeless situation. And our instinct originally was to, try and see if we can round everybody up for their safety, and seeing some things happening in the States where, you have to, when you do that, you have to be very careful because there's you don't want that to be a cluster in itself. So
Right, yeah.
even when you're going to do sheltering and having a very structured sheltering program, there's some public health risks that we needed to resolve and address before we head into that direction. But you'll see us making some movement on that regard too.
Right, LT. I just wanted to ask, and I know you're well aware of what's happening out here in terms of just the numbers of the meals that DOE has provided. I believe it's 260,000 total since
What?
the start of
Oh.
this, and the lines and people are waiting and people applying for food stamps. I just want to ask, do you does that hurt you when you think about these people hurting out here and that?
No, it's the top thing that I've been thinking about this entire time is, and this is even such a logistical problem because, you really need to discourage people. So when you saw the news where you saw all the people standing in line for the unemployment application in Florida,
right?
At risking their life. And part of it, so for us on that front, trying to get things out to people and minimize their risk of coming out, that's something that we're actively working on. And I would just tell you that that I feel that we're being very aggressive, but we're being very aggressive because each day that goes on, people's resources are less and less.
Do you feel their pain, Lieutenant Governor?
Oh gosh, of course. I mean, I probably can't feel their pain as much as they are because they're living it right now. But I'm very worried about it. That's something that's the reason why we're in office, is to try and address that kind of thing.
Mm-hmm. And I think that's why, you may see us getting emotional about it, because we do hear from people out in the community every single day, whether it's over the phone or if it's messages on Facebook, and they really are hurting.
Yeah.
So
and that's why
I don't know how to impress upon.
Yeah.
So can I just tell you that, there's other stuff going on, behind the scenes, and to what I guess what I would say is, it's not obviously where we're at right now is not where we would like it to be. Where we need it to be. I think that we're trying to figure out innovative ways to push things. We even have a bunch of commodities that DOE brought in that we're distributing with them in some of the low-income areas right now to try and bridge it. And we even tried to get people in the hotel community maybe to try and do some food banking for their employees, but that idea got shot down by some people that thought it was a dumb idea. But we'll just keep trying. Like I said, I don't want anybody to think that we think everything is perfect. It clearly isn't. This is a unprecedented situation, but I just want to tell everybody that we're gonna continue to push and try and push things out the fastest way we can. And I would just tell you that if you're looking at what's happening in some of the other states, they're doing their challenges, but I think that I would just tell you that we're committed trying to get these things out, and I think there'll be some good aid, at least for the people that are the lowest wage earners.
Right.
The group that is about to get paid are probably the ones that rely on tips more. People in food and beverage, they're hurting right now.
Hey, LT, I'd asked the governor a question yesterday about the tax refunds, and I kind of wanted to ask it again this last time. But what I had meant was that I know that the court order says we got to pay him 6 months from filing, but nothing's stopping us from paying him sooner. Is that an option that's being looked at, paying out the processed tax refunds that people filed in January, or has this ship sailed since we're getting the governor's got her $11 million plan, and I know Daphne's...
No. I would just actually, that is part of the push. Part of the push is to try and push those things out aggressively, and we'll get some details and get a path more in the next few days. But I would just tell you that I think that we're trying to be the most aggressive that we can.
Right. Going back to what you said about the DOE commodities. So today, grab and go meals. There's no meals today because it's Good Friday, and thank you to all the volunteers, the employees, everybody. Is there going to be maybe some kind of effort to help supplement what DOE is doing when they do start back up on Monday, or are we?
So the part of the planning with us is maybe about, I think the days are flying by so fast. Maybe about a week and a half ago, when we met with John Fernandez on Zoom, and he talked to us about what can we do to step up and increase the number of meals. Because you notice that it's been going up incrementally. So I would say that we probably continue we maximized it, to maximize and as much as we can put out, and with the assurances that we're coming in and providing the bridge financial support to get it done, and that's been done.
Right.
Maybe when I touch base with him later today, I'll ask him what more can be done. But I think that to suggest.
Did we lose him?
Was something nobody's ever dealt with, at least in 100 years, right?
Right.
And I think we're pretty open-minded to try and push things out in a very aggressive fashion.
Nice. I got a comment here on Facebook. You mentioned the commodities. I had some relatives who were getting these back, pre-COVID. Is that program? I know you mentioned it. How close are we to making that supply available?
So some of that's happening right now, and I guess I would say maybe if you can ask them to call my office at 475-9380 to tell us what neighborhood or housing area their relatives are from. Okay. If they're living in public housing, and which village, there is a strategy that we worked out with DOE to try and get those commodities out to everybody. Okay. And so just have them call my office and let us know, just state the concern. I have, just a couple people that are still here, right. I guess, that are able to act on those kinds of things.
Right. LT, the phones, the public health. I don't know if it was just the system crashed because so many people were calling. But are you aware of have the phones been repaired? Have we taken care of that? They have been
repaired, and I would just tell everybody to the best thing to do is to move it. Use the 311 option, and make that connection. But yes, the public health phones have been repaired. That was the briefing I got last night around 9.
Okay. Have you gotten any briefings on the Department of Corrections?
Yeah, so I know that the CDC has been up there. I'm very optimistic with that situation based on how the director has been handling things and responding to these threats and concerns. We'll know a little later in a few more hours when we get the update, but the last indication I got yesterday was that all of the processes have been working. So I'll just say that Joe Carbolito, the director there, for about 3 weeks already adopted a process that the Bureau of Prisons put out, a protocol. And then behind the scenes, the court, the AG's office, my office, we have been talking and working on reducing the number of detainees up there to reduce the risk.
Right.
And of course, that reduction will be based on all the people that are up there for nonviolent offenses and trying to reduce the risk up there.
When you say reduce,
the indicators that I think that those efforts are working.
So when you say reduce, you mean releasing them?
Yes. Or the judges will go in, take a look at the situation if it's nonviolent, and based on their living situation, they will make a decision to do a notice to appear instead of confinement.
Have you heard if anybody else has tested positive?
No, I haven't heard of anybody else.
Okay, LT, I'm getting a lot of messages from the families of inmates and detainees. They're saying that they haven't, visitation's been closed, but they haven't been able to get, needed supplies like sanitizers or whatnot to the inmates. I don't know if you can work out that, but more importantly, what would your message be to these families who are obviously having more anxiety because of this situation that's developing at the prison?
Well, I would just say that we have a medical team up there full time. As you know, we have a clinic up there. The last few weeks, they have been adopting some protocols to try and prevent the spread. And what I'll do is, I'll talk and find out what kind of how they could, if they're able to try and facilitate that kind of stuff to help. I'm not sure what the answer is yet, because, by reducing the visitations and trying to reduce the spread, there's consequences.
Yeah.
Access to people that are serving is not there right now. But even with humanitarian supplies, need to be screened, make sure there's no contraband. There's still, that's been an issue. So,
Good point.
Tough. We know it's tough. Yeah.
We'll have to, I'll raise it, and then I'll rely on the director to use his judgment to see what can be done.
I just kind of wanted to give you the opportunity to tell these families that, it's going to be okay, or this is something that you're looking at, right, closely.
Well, it has been. Actually, this was part of I guess because of the background I have at the court, and, one of our legal counsels used to be a prosecutor and a defense counsel, so we had already had early indications that we needed to make sure that we need to prepare for how corrections has to operate during this unprecedented crisis.
Right. LT, it's been go ahead.
Chris, I wanted to just say, though, that it's Good Friday today, right? So if you are supposed to be a good Catholic, practice being a good Catholic and stay home. But, I know Easter is a day that we're used to. There's a desire for us to be with our families. And unfortunately, this year, if you love your family, stay away from them. And I'll just give you my own example. I haven't seen my mom for, 3.5 weeks already. I see her on FaceTime. My nephew had his 8th birthday on Monday. I dropped the gift outside. I waved at him. You just need to sacrifice a little in as a matter of love. And so for me, obviously, I told you we meet with people, and you just never know what's going to happen.
Right.
So on Sunday, plan on WhatsApp, FaceTime, Zoom, whatever it is. A couple of my aunts are debating whether or not they should putty out what they would make, and deliver. But I told them reduce being on the road. So
Curbside pickup, LT.
Yeah, I actually have an aunt that said she wants to roast a ham, cut it into 4, and putty it out 4 ways. But
wow.
Even that, it's kind of like, I don't know if you should be doing that. Why don't we just, save it for the future?
I know you're in a position. Can we redo Easter after all of this? Is that possible through,
I think that we should, can I just tell you, I kept feeling so bad for the class of 2020.
Yeah.
I kept thinking, gosh, no prom, no graduation ceremony. I think we graduate several thousand kids every year. A lot of different situations going on, but the only silver lining is they'll definitely never forget that they're the class of 2020.
Right, and then because my boy's a junior, but he was saying with his classmates. But I think one of the consolations, if it's any, I don't know if it is that this is happening around the world, and you're not alone. Right.
That's right. I'm curious if they're going to have a Zoom prom.
Wow. Yeah.
God.
That would be
we'll see. Opportunity will come.
Right. LT.
Well, anyway, you two, look forward to seeing you sometime soon.
I know.
Yeah, well, you can Zoom us.
Yeah, let's do a Zoom.
Yeah, I don't mind. Do you guys do Zoom on your show?
Yes.
We could, yeah.
Oh, not this show.
I asked Crystal, if you're doing Zoom, she said, no, just phone call. Next time.
We're going to go on TV starting Monday, LT, 8 to 10 on TV 11. So we're going to figure out new
So
ways
is this your
to.
new morning show that has just launched amid
Well,
the crisis?
see what? Yeah, exactly. Before this all started, we had no plans on doing radio. But when everything started to heat up, we met on a Monday. How are we going to do this? And I said, maybe we should just do radio. It's immediate. It's fast. And the following day, we were on the air.
Yeah, and so what it does, LT, is KUAM, we've totally revamped all of our procedures in news and information gathering. We're operating with less than 10 employees in the whole building. We don't go out in the field. We conduct all of our interviews either over the phone or through Zoom. And so we figured this morning show would be a good kind of a meeting point for all the doctors, all the government officials, the people of Guam to kind of come here and put things out there that people need to know. And that was really
The whole idea.
yeah,
behind
it's
I
just
it.
think it's very helpful. And let me just close by this. Part of the when the government of Guam is giving information in such a very rapidly evolving situation, really the expectation, what we're doing is trying to make sure that message gets out by the person that we've elected to be in charge of the island. And I just want to tell everybody that, yes, I am, managing this crisis, but wanting to make sure that there are clear messages. Sometimes I've seen the criticism, maybe sometimes the message didn't seem to be clear, but I'll just give you this. The governor is doing everything she can, and her experience as a nurse and her knowledge about that has allowed our government to kind of do things a bit earlier than other governments have throughout the world and throughout the states. And I just also have to say that she's managed to get the attention from the federal government, even though it's competing with so many other places. And I'm really confident that, we're going to do our best for the people. We're not perfect. We have made mistakes, but we will never stop trying.
and the phone is working.
Yeah.
Right, got it. Yeah.
Well, thank you, Josh.
Yeah, man. LT,
Thanks a
thank
lot.
you so much. It was great. Is why we wanted to have you on. You got a lot of fans out
Okay,
here
and
standing on
again,
our Facebook.
Enjoy your time with the very, people in your house.
Right.
I mean, this Easter is a new beginning of many sorts. Let's just try and remember everybody that we love and care for them.
Thank you, and happy Easter, LT.
And hopefully we can
Yeah,
get you on again next week. Thanks,
Yeah,
bye.
yeah.
Okay, thanks. Bye-bye.
Okay, wash your hands. Oh, there you
He's
go.
so great.
Yeah, Lieutenant Governor Josh Tenorio. You know what I really appreciate about the Lieutenant Governor is he's never shied away from admitting that we're not perfect, we made mistakes, and I think that's sometimes a problem that the governor has, and you see it with Trump. It's very similar. But it was
I'm
really
just
good to
glad
hear
that-
from him.
I'm
Yeah,
glad he called in. He's doing fine. He gave us a perspective on what he and the governor go through every day with their 8:30 briefings, their cabinet meetings, and they have the press briefings. And it's good to know that behind the scenes, he's doing everything possible and working aggressively to get our island people the resources that we need.
Yeah, I feel like I had my fiber because I was so just backed up on wanting to know a lot of different things. And Lieutenant Governor Josh, really, I mean, because he's in the know and he doesn't have to go give it to someone else for them to, kind of decipher it and everything. So to get it straight from that source, I think it calmed a lot of people's nerves out here.
Yeah, I feel a little bit more calm.
Right. So